so now I think we've reached domain 4. If you have questions, go ahead and type in the chat, and we're going to get started. And we're going to begin with query. Now, when you started ICD-10-CM, you heard the term query, query the physician, query the physician. And some people might say, well, what is a query? What is a query? A query is to ask the doctor or qualified health professional a question. Yes, ask a question. But in medical coding, what is a compliant query? What is a compliant query? Well, a compliant query is to ask a non-leading question that adheres to the rules. And what is that, Mrs. J? This is to ask a non-leading question that has legibility. That means it can be easily read and understood. Clarity. That means it's straightforward without ambiguity. Completeness, that means it contains all pertinent information to answer the query. Consistency, it means it follows a standard format. And you'll see that there are templates. When you get in the real world, there are templates that you'll use. That means it's with precision, that the specific information is not broad or vague. Reliability, the query process produces accurate outcomes. And timeliness, that means it's sent in a timely manner. These are the aspects of the query. The compliant one. All right. So you'll see this a lot, this legibility, clarity, completeness, consistency, precision, reliability, timeliness. You'll see it a lot. Now let's talk about constructing this query. Well, there are two basic types of query. You have a verbal query and a written query. And both can be multiple choice, open-ended, or yes or no queries. What do you mean, Mrs. J? Well, your question can come with multiple choice options, open-ended options, or yes or no. So when you ask the doctor, hey, can we specify this diagnosis as, um, A, B, C, or D? Or what do you think the diagnosis is? Open it up for the doctor to answer, or a simple yes or no suffices. That's it. And remember, whether it's a verbal or a written query, you must follow the same rules for a compliant query. Just saying. All right, so we know that there are two types of queries and basically 3 ways to structure your query. Now, when to query? When do we query? Well, you query when the documentation indicates a diagnosis, but the diagnosis has been omitted by the provider, right? So, like the documentation wasn't clear. When the documentation is conflicting, one doctor says one thing, the other doctor says something else. When the reason for the encounter is not clear. When a certain diagnosis is not clinically supported. Patient has, let's say, let me get a diagnosis up here. Let me be applicable. A patient has a torn retina, but there's nothing in there that says that they took a test or they looked in the patient's eye or anything. How can you say that, provide that diagnosis when you have no clinical to support it? That might be a bad one, but it's one that I grabbed. All right. To confirm a diagnosis, you need to query. To establish a cause and effect relationship between medical conditions, you need to query. To establish diagnosis specificity, if you want to see if there's a higher level of specificity, to determine if a diagnosis past or current. You see that a lot with cancer. Number 9, to support present on admission assignments. When you're doing inpatient coding, you need to determine if something was POA, present on admission, if a diagnosis existed at the time of the admission. Number 10, to determine if a diagnosis has been ruled in or ruled out. To clarify the objective of a procedure. To clarify the presence of or absence of a complication, and to clarify a diagnosis documented by ancillary staff. Remember, we really can't code what ancillary staff documents unless it's, pressure ulcer stages and BMI, etc., but not too much. So these are some examples of when to query. So pretty much when the documentation is unclear, conflicting, or if you want to know if we can be more specific, okay? And when you take your exam, I'm going to show you some um, questions, exam-like questions, and somebody said, "Hey, are we going to do domain 3 questions?" Yeah, you had some domain 3 questions, but I will tell you there aren't too many for AI in your book because it's brand new. So hopefully, you'll get something on your exam that you can answer, but I don't know if it's going to be there yet. Okay. All right. So we know what the type of queries. We know when to query. Now we need to know who to query. Now this is different when you're inpatient. So if you're an inpatient coder sitting in here, this is who you query for outpatient and provider based coding. You query the providers that are delivering direct patient care. And if there are multiple providers from different specialties, query the most appropriate provider related to the query subject. What does that mean? Well, that means if a patient is, let's say this patient has heart, a heart condition, and let's say that they had a radiologist read an echocardiogram, or what do? They might read let's say they had an MRA, all right, and they provided one diagnosis. Oh, this patient has congestive heart failure. And let's say the cardiologist says this patient has hypertensive heart failure or hypertensive heart disease with heart failure. Then you're going to query the most appropriate provider to the query subject. If this is a heart condition, you're going to query the cardiologist, not the radiologist. So that's what that means. And finally, when providers present conflicting information, then you are going to query the attending physician. All right. So if you want to know, like if a person has a heart condition, you're going to query that cardiologist. But if there is a direct conflict, then you're going to query that attending physician. All right, you all with me? So we know who to query. We know the types of queries. We know pretty much when to query. We know who to query. Now let's talk about how to query. And I just want to make sure that you're with me. Someone said they're with me. Okay, this is how you query. Well, we know there's a verbal query. That's just basically speaking. We know that when you write down the query, there are 3 types of query questions: multiple choice, yes or no, open-ended. But when you construct this query, your query must have the following: patient demographics, How are we going to identify the patient, right? So if you're asking the doctor about patient Jones, if he can't find her in the system, then what are we doing? So put the patient demographics there or the medical record number so that the doctor can identify the patient. Then you're going to have to indicate what you're querying. Is it a diagnosis or a procedure? Then you have to tell the provider where in the chart there is a concern. Also, you're going to have to list the clinical indicators. Always list the signs, symptoms, diagnoses, the risks, and the treatments rendered. These are your clinical indicators. And then it's time to query. You need to ask a non-leading question with the following answer options, either multiple choice, yes or no, or open-ended. And ladies and gentlemen, this is how you construct a compliant query. All right. So again, whom to query? You query the doctor that's legally responsible for that patient or more closely related to the query issue. And this is outpatient or physician based here, what we're doing. However, if it's inpatient, you query the attending. Now, what are you going to query? When the documentation is insufficient, when it fails to meet documentation quality, when the health record standards are not met, you are going to query. So how to query? Again, put those patient demographics. What are you querying? Where in the chart? The clinical indicators, signs, symptoms, diagnoses, risks, and treatments. And then you ask your non-leading question. And you know that chart has to be updated within 30 days. That's your time frame. So what does a query look like, Mrs. J? What are you telling me? This is how you do it, but this is what it should look like. All right. This is a multiple choice query. On the right, these are your instructions on how to query, right? So number one, it says your query must have the patient demographics. And your demographics is right here. Number two, what are we querying? I'm going to query the diagnosis. The patient's admitted with pneumonia. You know what? Let me just go ahead and read this to you, okay? All right, so we have a multiple choice query here. The patient medical record number is 012121210. This patient is admitted with pneumonia. That is what we are querying. And the admitting history and physical reveals the following: a WBC of 17,000, and just so you know, these are clinical indicators. A WBC of 17,000, a respiratory rate of 26, a positive sputum culture, temperature of 101 degrees, heart rate of 122, hypotension, shortness of breath, and the patient is administered IV antibiotics and IV dextrose, D5W. These are all indicators. So you write it in there. This is, basically what the patient, these are their tests, these are their treatment, and these are their signs, symptoms, indicators, etc. All right. And then here is my query question. It is noted in the history and physical that the patient has pneumonia. Can pneumonia be further specified as, look at my multiple choice: simple pneumonia, gram-negative pneumonia, and coders, don't get scared because these are templates. In the real world, you have templates. All we have to do is just add the clinical indicators, and then we just select the template. Okay? So if we see pneumonia, we're like, okay, let's go ahead and specify it. And this is nothing that you'll need to know when you're taking the exam. I'm just showing you how a compliant query is constructed. All right, so here are all of my multiple choice: aspiration pneumonia, pneumonia secondary to influenza, other explanation or clinical findings, unable to determine, no further clarification. Please document your response in the patient's record. Thank you for your assistance. All right, so this is an example, and this is a template, but the pertinent clinical indicators, signs, symptoms, risk, and treatment were indicated right here. And that's what I typed in. Then my query question was provided. Can pneumonia be further specified? And then where to document and closing. All right, so how did you know to query this? In the real world, there is a list of diagnoses that you query. So you don't need to do all this. You just need to know some things. You just basically need to know what a query is and what a compliant query is and the types of queries, not this deep. But in CCS, we do go this deep. And we show you how to get these templates. So I just wanted to show you what a query looked like. All right. Now it's time to test your knowledge. Let's see what we'll get on the exam. All right. All right. So select the appropriate physician to query. A, the cardiologist, B, the respiratory consultant, C, the PCP, or D, the attending. The patient was admitted with ascites, dyspnea, JVD, edema, shortness of breath, and a chronic cough. The patient was treated with Lasix IV. The patient had a respiratory consultation with Dr. Brown, who diagnosed the patient with CHF. On the history and physical, the patient's PCP, Dr. Jones, diagnosed the patient with hypertensive heart failure. All right, coders, select the appropriate physician to query. All right. Good job. We're not fooling nobody. Outstanding. The physician that you query is the attending because there is a discrepancy. One doctor said this, the other doctor said that. And even though you might think it might be the cardiologist, but who says he even seen the patient even saw a cardiologist, right? And also the respiratory consultant and the PCP both are conflicting. I would think the respiratory consultant would take precedence. However, the attending will break, I guess here, here you go. That's what the the attending supposed to do when the providers present with conflicting information. All right. Are you all with me? Got another query. All right, Miss Eva, I think this is you.
Yes, ma'am. Okay, coders. Exercise number 2. Describe the type of query for each of the following. A. Dear Dr. Jones, this patient was diagnosed with CHF documented in the consultation and discharge summary. The clinical indicators include ascites, dyspnea, JVD, edema, shortness of breath, and a chronic cough. The patient was treated with Lasix IV. Based upon the clinical indicators and your professional judgment, can the CHF be further specified? If yes, please specify the CHF. Please document your responses in the patient's chart. B. Dear Dr. Jones, this patient was diagnosed with CHF documented in the consultation and discharge summary. Clinical indicators include ascites, dyspnea, JVD, edema, shortness of breath, and a chronic cough. The patient was treated with Lasix IV. Based upon the clinical indicators and your professional judgment, can the CHF be further specified as A, left ventricular failure, B, left-sided ventricular failure, C, left systolic failure, D, right-sided failure? If no, specify the CHF if applicable. Please document your responses in the patient's chart. C. Dear Dr. Jones, this patient was diagnosed with CHF documented in the consultation and discharge summary. The patient was treated with Lasix IV. Based upon the clinical indicators in your professional judgment, can the CHF be further specified? Yes or no? Please document your responses in the patient's chart.
Thank you, Miss Eva. Okay, so you all are answering. All right, so for A, what type of query is this? Is this an open-ended, multiple choice, or yes or no? All right, you all have answered, and you all have said this is an open-ended. It is because the query is based upon your clinical indicators and your professional judgment. Can CHF be further specified? And they're leaving it open for the provider to answer. There are no options. B, you all have said, somebody said they all open it. No, look at the thing. Look, look at the thing. That's my word. All right, so it says, based upon the clinical indicators in your professional judgment, can the CHF be further specified as A, left ventricular failure, B, left-sided ventricular failure, C, left systolic failure, or D, right-sided failure? So those are options. So if you said multiple choice and you all did, outstanding. And finally, C, it says, based upon the clinical indicators in your professional judgment, can the CHF be further specified? Yes or no? So that's a yes or no. So you pretty much have an idea of what the types of, excuse me, the types of com- queries there are: open-ended, multiple choice, yes or no. So you can identify that. Now it's time for you to determine if which one is compliant. All right. Which one is compliant? All right, so we did change them up just a tad bit. Miss Eva told me that. And I said, no, it's not changed. Is it? Hmm.
No, they are not.
I think B was changed a little bit. All right, so I'll just read the question. All right, so they all have the clinical indicators, right? And then it says, based for A, it says, based upon the clinical indicators in your professional judgment, can the CHF be further specified? If yes, specify the CHF. Please document your responses in the patient's chart. B, lists all of the indicators, and it says, based upon your clinical indicators and your professional judgment, can CHF be further specified as left ventricular failure? If no, specify the CHF if applicable. And C, can the CHF be further specified? Yes or no? All right, A, B, or C, which one is compliant? All right. All right. I'm going to tell you a little tip, and hopefully you can apply it later. But the answer is A. A is the compliant one because B is leading. Look at this. The patient was treated with, excuse me, based upon the clinical indicators in your professional judgment, can the CHF be further specified as left ventricular failure? The coder is leading this doctor to say that this patient has this diagnosis. And let me tell you, the coder may never introduce the diagnosis. Now, if it's multiple choice, if it's a template, that's different. But the coder may never introduce a diagnosis. All right, anybody know why C is incorrect? But it said which of the following is the most compliant of the queries? Well, they said there's no clinical indicators. There is treated with Lasix. That's one. You're right. That's very good. But they did give the Lasix. But this yes or no query is not the most efficient query because we have to make sure that our queries are legible, clarity, straightforward without ambiguity, completeness. That means it contains all of the information to answer the query. Like there should be no back and forth. If this doctor just says yes, then what are you going to do? You got to go back and say, okay, well, how can you further specify? That's a waste of time. So we need to be consistent. We need to have precision. We need reliability and timeliness. So we have to follow those components of a compliant query when we're constructing it. So C is not going to work. It is not the most compliant. A is it. And remember, coders, the coder may never, the coder may never introduce the query diagnosis. Never, ever, ever introduce that diagnosis. All right. I hope you didn't see that answer. Okay, now as you can see, when the wording looks like this, you know it was developed by AHIMA. So this is a question that you may see on your exam. Which of the following would require a physician query regarding proper clinical documentation? A, the diagnoses given do not match word for word the title of the ICD-10-CM code. B, a diagnosis is given without supporting clinical documentation. C, the social history does not contain information about smoking or drinking. Or D, the chief complaint does not match the final diagnosis. What say you? A, B, C, or D? Okay, I love it. I love it. I love it. And the answer is B. And here's why. You know that little when to query? Well, it's right here, number 4. When a certain diagnosis is not clinically supported, B, a diagnosis is given without supporting clinical documentation. All right. But there are certain diagnoses that can be reported without clinical documentation, like HIV, like COVID. As long as the doctor says it, that's fine. All right. All right. Under which of the following situations would it not be appropriate to query the physician? Okay, when it's not appropriate. A, there's conflicting documentation in the record. B, there is documentation on a procedure that is not supported by the diagnoses. C, when a diagnosis of sepsis is not supported by blood work results. And D, when there is incomplete or illegible documentation. Okay, coders, you're gonna have to figure this one out. and someone asked for a copy of the screenshot, or just remember you do have the playback, and also too will provide you with the handout in your LMS. Okay? You can have all of these copies, so don't worry. All right, what say you? This is tough. We struggled with this. Yeah, we did. And we came up with C. Here's why. All right, so when to query? Of course, when the documentation is conflicting. Look at A. There's a conflicting documentation in the record. So, under which of the following situations would it not be appropriate? It is definitely appropriate when the information is conflicting, right? Also, we ruled out B. There's documentation on a procedure that's not supported by the diagnoses. And I think it fits number 4, when a certain diagnosis is not clinically supported, right? And then, oh, let's go back. And then when there is incomplete or illegible documentation, if the documentation is incomplete or illegible, there is no way we can code it. So we have to query. So that leaves us with C, when a diagnosis of sepsis is not supported by blood work results. That is the one we've selected. Miss Eva said in her real world, she can code out a sepsis based on the doctor's documentation or saying so. So that is the only one that's left, and the other 3 have to go. All right, coders. This one is for you. And great job. A lot of you said it was correct. Good job. You all gave the correct answer. All right, so queries are appropriate for documentation that is not legible, complete, clear, consistent, precise, reliable, or timely. Documentation that thoroughly describes what is occurring with the patient is considered to be what? Is it consistent? Is it clear? Is it reliable? Is it complete? What say you? And here are the definitions. So clear, the definition is clarity; consistent, consistency; reliable, reliability; and D, complete, completeness. All right. And we came up with clarity. Look at this. Documentation that thoroughly describes what is occurring with the patient is considered to be clear. It's straightforward without ambiguity. Um, I like complete, and Miss Eva liked complete too, but the definition is contains all pertinent information to answer the query. So they're talking specifically about what is occurring with the patient. Okay, I know that was a tough one. All right, and I did pull out the toughest ones. Yeah, you all can do the easy ones yourself, right? Okay. All right. And finally, which of the following would be considered a leading query? And look at the text. This is coming from AHIMA. All right. A, based on your clinical judgment, can you provide a diagnosis that represents the clinical indicators of pneumonia? WBC 14,000, respiratory rate 24, heart rate is 20, hypotension, and altered mental status. B, the patient has elevated WBCs, tachycardia, and is given an IV antibiotic for Pseudomonas cultured from the blood. Are you treating for sepsis? C, Your impression in the history and physical indicated that the patient has chronic congestive heart failure with an ejection fraction of 25%. Can the chronic heart failure be further specified? And D, there is documentation of angina, along with evidence of evaluation and treatment of angina and health record. Please document the underlying cause and type of angina if known. All right, coders, what say you? Outstanding. Somebody said boom, boom, boom. And remember, okay, the answer is B. And the reason is, look, the coder cannot introduce a diagnosis nor point or lead a provider to a diagnosis. Look at B. They're asking you flat out, are you treating for sepsis? Look at A. Based on your clinical judgment, can you provide a diagnosis that represents the clinical indicators of pneumonia, WBC, da 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 da, and altered mental status? All right. This A is saying that these clinical indicators are of pneumonia. That is fact. But B, I think A can be leading, but maybe not, because maybe the doctors, mm, that's fact. But B is definitely leading because he's asking, are you treating for sepsis? Hmm. I gotta look at A because I'm like, oh, that's kind of sus. If B wasn't there, I would say A. But look at C. It says your impression in the history and physical indicated that the patient had congestive heart failure, right? Can the congestive heart failure be further specified? So the coder or the querier is not introducing the diagnosis, and there is the same with D. Angina is documented and the coder is using the word angina. But based on your clinical judgment, can you provide a diagnosis that represents the clinical indicators of pneumonia? Mm, 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 mm. I don't like that either. But B is also leading, and it's more leading than A. Oh my goodness, I don't know about this book, but I do want to tell you this. There are some things with the book. I like the book because it gives a great I think it mimics the exam very well. I think the book is a little more difficult than the actual exam, which I like because I felt more prepared when I went in. And I want you to just kind of follow what I'm saying in terms of the coder should introduce or point or lead the provider to a diagnosis. And I want you to go in there and grind this out. And I want you to pick the best of the four answers at all times. There's another inconsistency that I want to point out in your book, the answer key. The answer key is not there for the second part of exam one. All right, so I will be in touch with AHIMA and I need that answer key for you all. hmm Someone said, right, exactly, exactly. So if the doctor documents the diagnoses first, then you can say it, right? Because you're not introducing it. A to me appears to for it. I think it may be a misprint, but A appears to be leading, and so does B. But B is more leading. So I'm sticking to that.
Thanks for tuning in, and until next time, happy coding.